Assalamu alaikum my dear students. Today I will tell you about the phenomena of the excitation of the heart and how the impulses are conducted across the heart. So first of all, drawing the diagram of the heart. Now we know that SA node, it is the primary node or location where the impulses are generated. So SA node generates the impulses on its own without requiring any external stimulus. So SA node, you must need to remember, it generates the impulses on its own. It does not require any external stimulus, and it is located here at the posterior aspect of the right atrium, just at the base of the superior vena cava, or where the superior vena cava opens. Now talking about the dimensions of the SA node. So talking about the dimensions of the SA node. SA node, it is a cardiac, you can say a muscular band. It is a cardiac muscular band which is located here at the posterior aspect of the right atrium and just at the base of the superior vena cava, where the superior vena cava opens. So dimensions: 15 millimeter long, 3 millimeter wide, and 1 millimeter thick. These are the dimensions of the SA node. Now talking about the exact location of this SA node. So exact location of the SA node is posterolateral margin of the right atrium. Exact location, to talk about, so posterolateral margin, posterolateral margin, or posterolateral wall of right atrium, just at the base of the superior vena cava, or where you can see the opening of the superior vena cava occurs. Now furthermore, a question arises that why SA node can conduct the impulses on its own. The answer of this question is the presence of the funny channels, leaky sodium and potassium channels. So due to the presence of sodium, potassium, leaky channels, SA node is able to generate impulses on its own. So due to presence of sodium, potassium, leaky channels, the SA node can generate impulses on its own. So here sodium, potassium, leaky channels are present. Now furthermore, talking about that, how many impulses does SA node can generate in a minute. So first of all, completing this the diagram of the heart, we know that we have two atria and two ventricles. Now SA node is present here. So SA node actually generates 60 to 100 impulses per minute. And if we talk about the AV node actually generates 40 to 50 impulses per minute. So if we talk about the location of the AV node, just here at the junction of the atria and ventricles, the AV node is present. Now if we talk about the SA node, now the exact impulses which SA node actually generates is 60 to 100 times per minute, but we know that there are parasympathetic fibers that are innervating this portion of the heart. So that's why the impulses can be 70 to 80 times per minute. This was the information of the number of impulses which were generated by both of these nodes. Now further talking about So now talking about the conduction of impulses from SA node across the heart. Now you can see that impulses are actually generated from SA node in the form of through these bands. Through these bands, impulses travel from SA node towards the AV node. So, and this process takes 0.3 seconds. This process takes 0.3 seconds. Furthermore, impulses are holded in the AV node for 0.9 seconds. Now, why AV node holds the impulses, or there is a delay here, I would explain you later. And after this, the impulses travel. The impulses are conducted throughout the penetrating fibers of the ventricles, and it takes 0.4 seconds of the time. Now, talking about that, why the delay occurs, why the delay here occurs in the AV node. The cause of the delay is it actually possesses the less number of gap junctions. It actually possesses, and also the resting membrane potential is less negative resting membrane potential it has, and also it consists of small muscle fibers. These SA node and AV node consist of small muscle fibers. That's why the delay occurs here. That's why delay occurs. Small muscle fibers. Now talking about the importance of delay. That what is the importance of this delay? That why the AV node holds the impulse here for 0.9 seconds. The importance is because during now impulse has been conducting from SA node towards the AV node, and atria are now contracting. So impulse is being holded here, so that atria can contract completely and can deliver the blood towards the ventricle, so that when ventricles would contract, they actually become full of blood. So this is actually the reason. If no delay occurs here and impulse is not holded here in the AV node, so what would happen? Less amount of blood would flow from atria towards the ventricle. So here the delay occurs so that atria can contract completely, and more amount of blood can go to ventricles, so that ventricles can pump a good quantity of blood. So that's why this is the importance of the delay. Now talking about that, what happens here in the left atrium. So in the left atrium, the impulse travels through the interatrial fibers. So in the left atrium, impulse are being conducted through the interatrial fibers. So this was my lecture about the excitation of the heart, part 1. In the next information I will deliver you in the part 2. Thank you.